Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My dear students, today I'm going to talk about nasal polyps. And I'm sure you know what nasal polyps are, but still, if you ask me the definition of it, a nasal polyp is a pedunculated swelling of the nasal mucosa and the sinuses. Now, to show you through an example, a normal nasal polyp is a pedunculated swelling. Now, peduncle, what do you understand by peduncle? A peduncle is a pedicle, and just to show you an example, I've got this partially inflated balloon, and you may be able to understand through this balloon what I'm trying to tell you. Now, I'm not telling you that a normal nasal polyp looks like green colored balloon, but since that was the only thing I could get my hands on at the present time, so just forget about its color. Normal nasal polyps are usually pale in color. They're neither red, nor green, nor blue. They're just pale color or grayish in color. So imagine this partially inflated balloon as a nasal polyp, which is a swelling with a pedicle. Do you see it? This, if you imagine as a pedicle, this is the body of the polyp, okay? So let's just go ahead with further classification of nasal polyps. Bismillahir Rahmanir Rahim. Assalamu alaikum. My dear students, today I'm going to talk about nasal polyps. A nasal polyp is defined as a pedunculated swelling of the nasal or sinus mucosa. It's a grape-like swelling with the body and a stalk hanging loosely in the nasal cavity. While the types of nasal polyps can be divided into two, the ethmoidal polyps, also called allergic nasal polyps, and the second type is antrochoanal polyp. Now, talking about ethmoidal polyps are multiple, bilateral, pale, grape-like swellings which arise from the ethmoidal sinuses and present in the middle meatai. They are insensitive to touch and don't bleed on touch. Etiology, or the causes of nasal polyps, can be multifactorial. Various diseases associated with the formation of nasal polyps are chronic rhinosinusitis, Cartagena syndrome, cystic fibrosis, asthma, aspirin intolerance, allergic fungal sinusitis, Young syndrome, Church-Strauss syndrome, nasal mastocytosis. While the pathogenesis of a nasal polyp can be like that, while the nasal mucosa becomes edematous due to collection of extracellular fluid, which gives rise to polypoidal change, which in turn produces a sessile type of polyp, and that polyp later on becomes a pedunculated swelling and a pedunculated polyp due to gravity and excessive sneezing. Now, the site of origin of ethmoidal polyps. Ethmoidal polyps, as you know, multiple nasal polyps they always arise from the lateral wall of the nose, usually from the middle meatus, while the common sites in the lateral wall of the nasal cavity are uncinate process, bulla ethmoidalis, ostia of sinuses, and medial surface and edge of middle turbinate. Symptoms that can arise because of ethmoidal nasal polyps can be very many. The first symptom can be nasal airway obstruction, while post-nasal discharge or post-nasal drip, headache, rhinorrhea, sneezing, hyposmia or anosmia, which is decreased sense of smell or loss of sense of smell, and snoring. Signs of ethmoidal nasal polyps: on anterior rhinoscopy, polyps appear as smooth, glistening, grape-like masses, often pale in color, often multiple and bilateral, may be sessile or pedunculated, insensitive to touch, and they don't often bleed on touch. While long-standing cases of ethmoidal polyps may give rise to a broadening of nose, which so much so that it can be called as frog face, and increased intercanthal distance, while a polyp, ethmoidal polyps, may protrude from the nostril and appear pink and vascular, simulating neoplasms. Purulent discharge can also occur due to associated sinusitis. Now, when a case of polyposis comes to us, laboratory investigations which can be done in such cases, apart from the routine clinical examination, we've got a routine blood examination, which is a blood CP, then serological radioallergosorbent test, also called RAS test, allergic skin testing for those who are having polyp associated with allergic rhinitis, sweat chloride test, which is genetic, and also genetic testing for cystic fibrosis in any child with multiple benign nasal polyps. Nasal smear eosinophils may differentiate allergic from non-allergic sinus diseases, while biopsy from the polyp after evaluation by CT scan and MRI. Now we come to the treatment of ethmoidal polyps. Treatment, first of all, can be medical. If the patient has not already tried a treatment and the nasal obstruction is not a complete sort of obstruction, there is some room for the nasal drops to go in, then we try intranasal corticosteroids, which can be in the form of normally used intranasal steroids are usually beclomethasone, saclisonide, flunisolide, fluticasone propionate, fluticasone furoate, mometasone furoate, triamcinolone acetonide. While if the polyps are very many and causing a lot of problem to the patient, and if there is no contraindication to systemic corticosteroids, then one may try systemic corticosteroids in the patient as well, which can be given as tablets and depot injections. Oral prednisolone can be given at 25 mg daily for 10 to 15 days, as a depot injection corresponds 100 mg of prednisolone. It may serve as a medical polypectomy. While if the patient does not get better on medical treatment, or if the medical treatment is not appropriate for the particular patient, then one opts the surgical treatment. And that is in the form of a nasal polypectomy to start with. In that case, in bilateral ethmoidal polyps, one tries bilateral ethmoidal polyps, polypectomy, also called nasal polypectomy. That can be done under a local anesthetic or sometimes a general anesthetic. While intranasal ethmoidectomy is usually done in those cases which are usually recurrent and the polyps not getting better on simple nasal polypectomy, then one goes up and tries removal of ethmoid sinuses as well. And that is partial ethmoidectomy can be done through the intranasal route. If that does not help, or if intranasal ethmoidectomy is not advisable in that particular patient, one can try extranasal ethmoidectomy, which is an incision on the face which then goes towards the ethmoid sinuses directly, and then the sinuses, ethmoids are removed. Transantral ethmoidectomy usually tried when the maxillary sinuses are also involved in the polyps. One removes the polyp from the maxillary sinus and then goes towards the ethmoids and does do the ethmoidectomy. While functional endoscopic sinus surgery, also called FES operation, is usually tried nowadays, sparing ethmoidectomy through the transantral route or the intranasal ethmoidectomy route, avoiding external incisions. Now we come to talk about antrochoanal polyp. An antrochoanal polyp, as the name implies, is a polyp which arises from the maxillary sinus mucosa near its accessory ostium, comes out of it and grows into the nasal cavity, forming its nasal part, continues to grow towards the nasopharynx through the kyon, where it further enlarges to form its choanal part, as you can see it in the picture. Etiology of an antrochoanal polyp is not exactly known, so exact cause is unknown, while nasal allergy along with sinus infection is usually incriminated, seen in children and young adults, usually single and unilateral, as you can see on the CT scan. There is a left-sided maxillary sinus opacity along with the opacity going towards the nasal cavity as well. The site of origin of antrochoanal polyp, it arises from the mucosa of maxillary antrum near its accessory ostium, comes out of it and grows in the choana and nasal cavity. Thus, it has three parts: antral, which has got a thin stalk, choanal part, which is round and globular, and nasal part is flat from side to side. Symptoms of antrochoanal polyp can be unilateral to start with, unilateral nasal obstruction. But when the polyp grows larger in size, bilateral nasal obstruction occurs as well. When polyp grows into the nasopharynx and it starts obstructing the opposite kyon, it causes a bilateral nasal obstruction. Thick and dull voice may occur. It's also called hyponasality, while nasal discharge would become mostly mucoid and thick. Now, signs of antrochoanal polyp on posterior rhinoscopy It's a globular mass filling the choana or the nasopharynx. A large polyp may hang down behind soft palate and present in oropharynx. Treatment of antrochoanal polyp is usually surgical. One avulses the polyp, removes it through the nasal route or oral route. While recurrence is uncommon after complete removal, Colwell-Look operation is done usually in case of recurrence, which removes completely the polyp from its site of origin, while functional endoscopic sinus surgery is now preferred to doing a Colwell-Look operation. Now this compares the ethmoidal polyps with antrochoanal polyp. As far as this slide is concerned, one can talk about the age. Ethmoidal polyps are usually common in adults. Antrochoanal polyp is common in children, while etiology, allergy or multifocal in cases of ethmoidal polyps, and antrochoanal polyp is usually said to be due to infection. Number of polyps, ethmoids multiple, while antrochoanal polyp usually solitary. Laterality of the polyps in ethmoids, bilateral in case of ethmoidal polyps, while antrochoanal polyps usually unilateral, and in rare cases it can be bilateral too. Origin of ethmoidal polyp is ethmoidal sinuses, while the antrochoanal polyp arises from the maxillary sinus near its accessory ostium. Growth mostly anteriorly and may present at the nares in cases of ethmoidal polyp, whereas antrochoanal polyp grows backwards to choana, may hang down behind soft palate. Size and shape of the polyp in ethmoidal polyp cases, usually they are small and grape-like, while antrochoanal polyp is a trilobed structure with antral, nasal and choanal parts. Recurrence is quite common in ethmoidal polyps, while it's uncommon in cases of antrochoanal polyp if that has been removed completely. Treatment of ethmoidal polyp can be nasal polypectomy or face operation, which is again functional endoscopic sinus surgery, or in recurrent cases can be ethmoidectomy operations. While antrochoanal polyp, one removes through the nose, avulses the polyp, or it can be done through the endoscopes with face operation, which is functional endoscopic sinus surgery again. Now, talking about differential diagnosis of polyps, one can have a blob of mucus looking like a polyp, which usually disappears on blowing the nose, whereas hypertrophied middle turbinates usually appear pink and they have a hard feel of bone on probe testing, and the probe usually does not go around the turbinates. Whereas if it's an angiofibroma, history of profuse recurrent epistaxis may be there, and it's firm in a consistency and it easily bleeds on touch. Whereas neoplasms, usually fleshy and pink in appearance, and they are friable in nature and they have a tendency to bleed. Now, differential diagnosis, one can talk about following are the unilateral swellings in the nasal cavity that may mimic polyps, but they are not true polyps. Hence, such ambiguous swellings must be investigated properly before treating them. Encephalocele or meningoencephalocele in newborns and infants. Gliomas in newborns and infants. Benign neoplasms, for example, juvenile nasopharyngeal angiofibroma, which bleeds on touch easily. inverted papilloma, and malignant tumors, usually fleshy, pink, polypoidal swellings which may bleed on touch. Well, that was all about nasal polyps. Thank you very much.